Make sure everybody's smiling now.
A little bit, but small price to pay.
We're supporting the public option. Yes.
What you're trying to do is create an array of choices that currently don't exist. If you have to be a federal corrections officer, you too, and we all together can go into an array of choices and select the one that makes the most sense for us and the one that we're willing to pay for. So if the public option, as a public option, if it's passed and it becomes a part of that array of choices, I would look at it, and if it's the most cost efficient for me and the most effective, as I would hope it would be, I would most certainly choose it.
So more and more Americans will lose their employer-based health insurance. Those who do have it, the cost of it will continue to increase. More and more of the dollars generated by our economy will go into health care. So I remain committed to pursuing the public option. I do think it's so fundamentally important. I look forward to voting for it on the floor of the House, and I do believe it will be in the House bill. I cannot predict what is going to come out of the Senate, and I cannot predict what is going to come out of the conference once these two bills are put together. And so, yes, there's always the possibility of coming back if some of these things are not in it. I don't know how a pilot public option would work. I think it has to be sort of all or nothing. I haven't heard any arguments around it. The co-op program has been put out there as a way to go. There are parts of this country that have used that system very well, but very small parts of it. And I have a lot of questions around it, but there's no denying that we cannot use our differences at this moment in time to do nothing.
We got a email question from Wayne, who identifies himself as a conservative independent. He wants to know, he's a senior on Medicare and is concerned whether future benefits will be affected as a result of health care reform.
There is absolutely nothing in this bill that affects benefits. It's really about tweaking, saving dollars that are already being spent in the system and making them more effective, really sort of wringing out a lot of waste that's in the system and putting it to better use to help offset the cost of expanding coverage for the 47 million uninsured. So, and in fact, with all the effort that is going into shoring up Medicare, it actually extends its solvency for 5 years.
Margaret in Andover, you're up next with Congresswoman Tsongas.
Am I on the air?
Yes, you are, Margaret. Go ahead.
Hi, Margaret.
Hi, Nikki. Yes, Nikki, could you address euthanasia for me, please? Some people are telling me that at a certain point you're going to hand me a pill and say, Margaret, go home and go to sleep.
Thank you for the call, Margaret. We appreciate it.
Thank you for your question, and we don't mean to laugh because end of life decisions are very, very difficult for everybody. For those of us, we all eventually have to deal with it for our own selves, and it's always difficult, awful for our families. And what this did was say, if you choose to have that conversation with your doctor, you don't have to do it. Your doctor doesn't have to have it. But if you choose to have it, the doctor could be reimbursed for his time. And it was as simple as that. It's obviously become a lightning rod, greatly mischaracterized, in spite of the fact that over and over again it has been debunked as the death panel. There still persists this impression that that's what it's all about, and nothing could be further from the truth.
Hi, Jenny. Hi, you're going to be up next, but could I just ask you to turn down your radio?
The House and the Senate.
That's okay. Just so there's no feedback.
So that is where is it coming from? It is coming from roughly $700 billion dollars already being spent in the system, but are not being spent very wisely and are not actually improving anybody's care. And there are entities that have been looking at this for a long time, see where there are very appropriate savings, and those dollars can be used to help offset the federal dollars that are going to have to serve as a subsidy. The debate really is coming from where to make up the difference, the other $300 billion. And the House has had one version where it would tax people, I think at this point it's on a sliding scale, people who make over and above $350,000 a year, and then at $500,000 it jumps a little higher. That's the House version. The Senate has yet to come out with its version of how to pay for it. But what all the private insurance
Doris,
companies that
and your
currently
query calling
provide
from Doris?
insurance through their
Take it.
employers, the
And,
private
what
insurance
do you wanna
companies
ask
that
the
would be
congressman?
available for anybody.
No, your questions were so good.
Convinced them, yeah.
You were remarkable. Did you realize you went an hour and a half straight?
Yes, I did.
Question after question? Oh, she realized.